Now today we are going to discuss one portion of physical examination, that is percussion. Percussion is not only used for physical examination, sometimes it is used for treatment purposes as well. For example, during the physiotherapy of the chest, we percuss the chest to mobilize the secretions so that they are easily expectorated. But today we are not going to discuss that portion of the percussion, we are just going to discuss the portion which is used in examination. When we examine the abdomen or the chest, there are 4 steps. There is inspection, palpation, percussion and auscultation. So we are going to discuss only percussion. Now what is percussion is we tap the body and produce a sound, and we listen to the character of that sound to determine what is the possible underlying pathology. So it is just tapping of the body. The percussion can be an indirect percussion. Indirect percussion is that we do not directly tap the body. We put our hand in between and then we tap the body. And then you can have a direct percussion. Direct percussion can be without tools, it can be with tools. Now, when we do indirect percussion, we actually elicit information to see what is the consistency, what is the size, and what is the probable border or shape of the underlying organ or pathology what we are interested in. So when we do indirect percussion, we can see what is the possible underlying structure. For example, if this is an air-filled structure, for example, it's a lung, it produces a resonant sound. Or if this is a fluid-filled structure, for example, urinary bladder, it may produce a dull sound. Similarly, if we have a solid organ under it, it may produce again a dull sound. For example, a liver is a solid organ, can produce a dull sound. Now, when we do indirect percussion, we need to know 2 things. What is the proper method of percussion and what are the rules which we should follow when we are percussing. Now, in indirect percussion, the first thing we discuss is what are the methods of percussion. Now, in the methods of percussion, we define 2 instruments of our hands. We take the non-dominant hand and the dominant hand. The middle finger of the non-dominant hand is called pleximeter. This pleximeter is placed in firm contact with the skin of the area of our interest. For example, if we want to examine the liver, we place this finger in the right hypochondrium. Similarly, if we want to percuss the bladder, we place the finger in the hypogastrium. Now the second instrument is the middle finger of the dominant hand, which is called plexer. Now middle finger of this hand is used to strike the pleximeter. Now how we do the percussion is we place the pleximeter in the area of interest and give 2 quick, sharp and firm taps from the plexer on the pleximeter like this. And we note what is the sound produced. We record that sound in the mind, that what sort of sound was produced. So this is the method of percussion, and you see it when we see many doctors or students are percussing like this. This is not the proper way of percussing. The dominant hand should be on top of the non-dominant hand and should be percussed like this. And if you have to change your position, don't change your position of hands like that, change your position like that. For example, when we do percussion for the shifting dullness, we start from the epigastrium and we can move it like this. And when from this position we have to move to the flank, we don't change our position of hand like that, we change our position like that, and then we can percuss like that. So this is how the percussion should be done. And the second thing to keep in mind is that the blow should be given from the wrist. It should not be given from the elbow. It should be given from the wrist. So these are the methods of percussion, that we place the pleximeter in firm contact with the area of interest and strike with the plexer. The blow is given at the wrist and not at the elbow. Now, what are the rules of percussions? There are 2 rules of percussion. That we move from expected resonant to expected dull area. We can figure out, and we have a picture in the mind about the internal organs. For example, if we want to percuss the liver, we can see the liver has a horizontal border normally, which is extending between the epigastrium and the right hypochondrium. So we can place our finger like this. And since the liver is dull and below the liver this is gut, this is usually resonant. So we move from the expected resonant to expected dull area. And similarly for spleen, spleen enlarges in this direction towards the right iliac fossa, and you can start percussing from the right iliac fossa like this. So we move from the expected resonant to the expected dull area, and the movement is at 90 degrees at right angle to the border of expected dullness. So these are two rules. The method was that we place the pleximeter in firm contact on the skin of area to be examined, and we strike with the plexer. The blow is given at the wrist and not at the elbow. The rules are that we move from the expected resonant to expected dull area, and the movement is perpendicular to the border of expected dullness. And then we've got direct percussion. Direct percussion can be without tool. Without tool is that we do not use any instrument, but we use only one hand and percuss with one hand. And then we record our findings. This direct percussion is sometimes used to do check the tenderness in the bone or the sinuses, and sometimes this is also used in infants to assess the lungs. So we can use this without tool. And then direct percussion can be done with tools. Now this percussion with tool is generally not used for eliciting sound. For example, we use a reflex hammer for tapping, and from this reflex hammer we see what are the deep tendon reflexes like. So this is not basically to elicit sounds. To elicit sounds we use either the indirect method or the direct method without tools. With tools we actually do not elicit sound, we just see what is the reflex like. So it is done in the neurological examination and not in the examination of the chest or abdomen. So this is briefly about percussion.